in this video we are going to discuss about the parietal bone. So we have paired parietal bone. See, it forms the boundaries of the cranial cavity. We have a right and left parietal bone. This is the right parietal bone. We have to hold it like this in an anatomical position. So it has two surfaces, the outer and the inner one. 4 borders. This is the anterior border or frontal border. This is the superior border, or you can say the parietal border. Posteriorly, this is the occipital border. Inferiorly, this is the temporal border. And because it is connected with the frontal bone, it is connected with the other parietal bone like this, and posteriorly with the occipital bone, inferiorly with the temporal bone. And it has 4 angles. This is the antero-superior angle, antero-inferior angle, antero-posterior, and posterior-inferior and posterior-superior angle. Fine. So the outer surface is convex and it has lines. We call them temporal lines. So we have superior temporal line, and then this is the inferior temporal line. Fine. So in this it is very clear. Superior temporal line, the temporal fascia is attached over here. Inferior temporal line for the temporalis muscle, and below this is the temporal fascia. Temporal fossa. If you remember, this is the temporal fossa. So from the temporal fossa there is the origin of temporalis muscle, and in there is a small parietal foramina. In this bone I am not able to show you, but there is a small parietal foramina. Through this parietal foramina, see in this bone I can show you. This is the parietal foramina through which emissary vein passes. Emissary vein passes, which connects the extracranial vein to the intracranial vein, that is the superior sagittal sinus. So this prominence is known as the parietal tuber or tuberosity. Fine. Now on the medial surface you see number of the impressions. These are the groove for the cerebral gyri, and you see the impressions at the anterior-inferior angle of the impression of middle meningeal vessel. This is the parietal branch, frontal branch. And at the posterior-inferior angle, we have a groove for the sagittal sinus. This and on the upper part, or the where the superior border is there is a groove for the sagittal sinus. When it is connected with the other parietal bone, becomes a sulcus where the superior sagittal sinus runs, and through the lips of the groove there is attachment of the falx cerebri. Falx cerebri, that is the fold of the durameter, that is the meningeal layer of the durameter, which is from the falx cerebri. So this I am showing you. This is the lips of the superior sagittal sulcus, in which superior sagittal sinus run between the 2 meningeal layer of the durameter. That is, it forms the falx cerebri attached over here. Fine. Now the important point is this anterior-inferior angle. You see, this is attached to the number of the bone. Anteriorly, frontal bone. This is the greater wing of the sphenoid and squamous part of the temporal bone. To this point, it forms the PTERION. Anteriorly. And posteriorly, the posterior-inferior angle, it is again attached to the, or it makes the joint with the squamous part of the temporal bone, mastoid part, and the occipital bone. See, it forms the PTERION. Fine. And the most important point regarding this, when the ossification starts, it starts from the parietal tuberance or parietal tuberosity, it moves towards laterally or outward. So these angles, they ossify in the later stage and they form the fontanelle. Anteriorly, when it is attached to the frontal bone and the other parietal bone, this is known as the bagma, and there is fontanelle is known as the anterior fontanelle. This is the anterolateral fontanelle, this is the posterolateral fontanelle, and if we move like this is the lambdoid suture which forms the occipital bone, this is the posterior fontanelle. So in this diagram I will show you. So this is the anterolateral fontanelle, posterolateral fontanelle, anterior fontanelle, posterior fontanelle. These fontanelle, they fuse within the 3 months to 6 months, but this anterior fontanelle, this is the largest one, it fuses at the age of 18 months, or you can say 1.5 year. 1.5 year. Fine. The importance of these fontanelle is they help in the increase or the growth of the cranial cavity, growth of the brain, and whenever there is any increased intracranial pressure, these fontanelle, they bulge. Fine. When there is a dehydration, it gets depressed, and at the time, the most important is they help at the time of the passage through the birth canal so that they can overlap. So this is the very much importance of regarding these fontanelle. So this is very common question in the viva. This is regarding the parietal bone. Thank you.